What's up, ladies and gentlemen? Welcome back to Neurosketch with Dr. Kenny. But if it is the first time you've seen this channel, don't forget to subscribe. Today we're going to discuss anatomy of the cranial cavity. We're going to talk about the surface features of different parts of the cranial cavity, but most importantly, we're going to discuss about different foramina, a lot of foramina, and it looks like we have quite an ambitious program here. Going back to square one, we say the skull is made of neurocranium, which is housed in your brain, and the visceral cranium, which is also called the facial cranium. Now, the neurocranium is made up of eight individual bones, which are called the cranial bones. So we have 80 cranial bones, and out of these, we said parietal and the temporal, they are paired bones, and the rest are unpaired bones. Now, because these bones, they are housed in the brain, they should have a cavity within it, and that cavity is called the cranial cavity, and that is the topic of discussion today. Now, the cranial cavity can be divided into two parts. It has got a cup, which is called calvaria or calvarium, or is also called the skull cup or the cranial vault. This top part of the cranial cavity that is covering the cranial cavity on the top is called calvaria, or the skull cup, or the cranial vault. The cranial vault. And then this is when you assume that you are cutting through this plane to separate the cranial cavity like into the vault, and then the remaining one is called the cranial base, or the base of the skull, or the skull base. So it's skull base, the base of the skull, or the cranial base, they mean the same thing. And this bony framework that is left once you remove the cranial cavity, once you remove the calvaria or the skull cave. Now picture your calvaria as this cup here, and if you flip, this is another picture showing your the skull with the skull cup, which is the cranial vault, which is your calvaria, and the cranial base, the cranial base here, the cranial base. All right, excuse me, I forgot to do this one. This is not the skull cap, this is the skull cap. This one, the calvaria, the skull cap. You can always delete that in your mind. All right, now if you flip this the calvaria or the skull cap, this is what it looks like inside. So this is the inferior view of the cranial vault or of the calvaria. This is superior view of the calvaria, this is inferior view, and this is like your flip your cap. All right, so the calvaria outside, you can see it is made up of the frontal bone, the two parietal bones, and the occipital bone, right? And then we said we have a lot of sutures, as you can see. We say the frontal bone is connected to parietal bones by the so-called coronal suture, and we have already seen about it. And we have two parietal bones which are connected by the sagittal suture, and then we have the lambdoid suture, which is lambda-like, connecting your parietal bones into the occipital bone. And then we have an impression here, a groove in the groove running in sagittal plane, and this groove is called a groove for superior sagittal sinus. Perhaps you don't know what this sinus is, but we'll have a discussion that we're going to discuss about all these sinuses, and it will make sense once we do. And then we have a lot of footprints, like prints which are left on the cranial vault by different structures. For example, this groove here it's fanning like an artery, right? So it's a groove for branches of the middle meningeal artery. So that's a middle meningeal artery is fanning here, so forming like prints on the skull cup, on the calvaria. And then we have another grooves, prints. You see, we have a lot of these prints. Yeah? We have another prints here. These prints are called the granular foveae, foveora. The granular foveora, and the granular foveora, they are 4 arachnoid granulations. Again, you don't know these arachnoid granulations at this moment. Don't worry, we're going to discuss about them. But we know in the back of our mind that the skull cap or calvaria has got impressions that are occupied by different structures, and one of them is the arachnoid granulation, which form these prints, and these prints are called granular foveora. Granular foveora. Yeah, this is the cranial vault, the cap of the cranial cavity. Next is gonna be your skull base. and this is the base of the skull, or the skull base, or the cranial base. All of these are the cranial base. Now the cranial base can be divided into three fossae, and it has got anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. The middle cranial fossa, I want you to treat this middle cranial fossa in 3 dimensions, and you see the middle cranial fossa is a butterfly shaped again. It's a butterfly shaped. It has got like something like a body inside here, and then a little bit like wings on the lateral side. Now, we have divided the cranial cavity, the cranial base, into three fossae. We've said we have anterior cranial fossa. I've just taken a half of it to have an inside, but we have bilateral, like we have on the right side and on the left side as well. Now, this is anterior cranial fossa. This is the middle cranial fossa, and this is your posterior cranial fossa. But again, remember, the middle cranial fossa is a butterfly shaped. It is a butterfly shaped. So what demarcates the anterior cranial fossa and the middle cranial fossa? The anterior and the middle cranial fossa are being separated by a lesser wing, a line through a lesser wing of the sphenoid bone. We discussed about the sphenoid bone. You can always go back to watch that discussion. And then the middle cranial fossa is separated from posterior cranial fossa by the line through the petrous ridge of the temporal bone. Okay. In turn, now the the anterior cranial fossa, it is housed in the frontal lobe, bilateral frontal lobe. I mean, frontal lobe on the right side and the frontal lobe on the left side. The middle cranial fossa is housing all the way from the sella tussica. Remember here where you have your sella tussica of the sphenoid bone. You haven't watched the sphenoid bone, and you have to go back and watch the sphenoid. So this is a sella tussica, and then so it houses the pituitary gland, because pituitary gland sits in the sella tussica, and then it also houses the temporal lobe of the cerebral hemisphere, on this side and also on the other side. And then your posterior cranial fossa will house mainly the cerebellum and the brainstem. And of course, perhaps you don't know what a brainstem is, but we're going to discuss about them at some point. We're going to discuss about these structures at some point. Yeah. Now, on the middle cranial fossa, we have already discussed the sphenoid bone a lot of times, but you can see we have some impressions in the middle cranial fossa. We have some impressions, and these impressions you see like these are fanning like an arrow, right? And then we said, because this is foramen spinosum, we already discussed about this foramen in discussion of sphenoid bone. This is foramen spinosum, and this foramen spinosum is for your middle meningeal artery, middle meningeal vein, and meningeal branch of the of mandibular nerve. Middle meningeal artery, vein, and meningeal branch of mandibular nerve. Now, these impressions here. This is impression for the branches of the middle meningeal artery. The branches of a middle meningeal artery are passing here, and they are leaving the prints. Those prints. Okay, one more time. We have anterior cranial fossa, middle cranial fossa, and the posterior cranial fossa, and we have the separation. There's a wing and petrous ridge of the sphenoid bone. Now, on the anterior cranial fossa, we have very, very important impression, which is called crista galli, and the crista galli is of your ethmoid bone. This is the ethmoid bone as it looks from superior or anterior direction, and this is the so-called the crista galli. This is the crista galli, and this is what is seen in crista galli. Now, the crista galli is a very important landmark for attachment of the superior sagittal sinus. The superior sagittal sinus, it attaches anteriorly from the crista galli, and posteriorly it attaches to internal occipital protuberance. You guys remember we had external occipital protuberance when I discussed the outer surface of the occipital bone, and this is the internal surface of the occipital bone, and this is the internal occipital protuberance. Now, the superior sagittal sinus, it runs anteriorly from the crista galli, and posteriorly it goes all the way to the internal occipital protuberance. We have already seen the sella tussica. It's formed of tuberculum sellae, dorsum sellae, and hypophyseal fossa. And you guys remember what sits in hypophyseal fossa? That's your pituitary gland with the so-called hypophysis. And then we have a foramen here, which is called the foramen magnum, and the foramen magnum means the largest foramen. I mean large foramen, the foramen magnum. On the posterior cranial fossa, you can see you have prints for which are the grooves for the posterior meningeal arteries and veins. The posterior meningeal arteries and veins, these are the grooves, and we've seen on the middle meningeal, we'll have the on the middle cranial fossa, and then you have we'll have another impression here, which is the internal occipital crest, but we'll have the sinuses, remember. So we'll have the superior sagittal sinus, the occipital sinus, and the transverse sinus. Now, these on the occipital bone, we'll have a groove here for the occipital sinus. We're going to discuss about these sinuses, don't worry about them. And then we'll have the groove for superior sagittal sinus here. This is a groove for superior sagittal sinus, and also have a groove for transverse sinus. Now, next we're going to discuss the foramina, and we're going to start from anterior cranial fossa. We're going to the middle cranial fossa. Most of the foramina of the middle cranial fossa we have already discussed when we are doing anatomy of the sphenoid. Again, you have to go back and watch the discussion of the sphenoid bone. It's very, very important. You can never skip sphenoid bone if you want to understand the cranial cavity, the anatomy of the cranial cavity. So on the middle cranial fossa, today we're going just to rush a bit, and then we're going to the posterior cranial fossa to see different foramina. Now, from anterior cranial fossa, we've said this is anterior cranial fossa, and the main feature in the anterior cranial fossa, the main feature which is going to bring a lot of this foramina, it is the ethmoid bone. This is the ethmoid bone, and this is the crista galli. Now, very, very anterior to the ethmoid bone, we have a foramen here, which is called the foramen cecum. And the foramen cecum is easy. It's just for your emissary veins, and you remember emissary veins, they communicate. So emissary vein on the foramen cecum, they are communicating to the superior sagittal sinus. Remember, the superior sagittal sinus is also a venous system. It says it indicates the venous blood. And then you have your nasal slit here. You have a nasal slit as well as anterior ethmoidal foramen. So the nasal slit and the anterior ethmoidal foramen, these are for your anterior ethmoidal VAN. Anterior ethmoidal V, nerve, artery, and vein. Anterior ethmoidal VAN. And next is gonna be your famous foramina of the crib from plate. You can never forget about the foramina of the crib from plate, because the foramina of the crib from plate, these are for your cranial nerve number 1, which is olfactory nerve. So olfactory nerve has got a lot of like fibers that are going through the ethmoid bone, and we're exerting the ethmoid bone through these foramina, which are called the foramina of the cribriform plate. We have already discussed. We have discussed the ethmoid bone at some point. You have to look for the link and watch that discussion. And then, because we had anterior ethmoidal foramen, we also have posterior ethmoidal foramen, and the posterior ethmoidal foramen is for your posterior ethmoidal VAN. Anterior ethmoidal is for anterior ethmoidal VAN, posterior is for posterior ethmoidal VAN. That is anterior cranial fossa. And then we're going to the middle cranial fossa, and a lot of structures in the middle cranial fossa we have already discussed, so it's just a matter of revision. Number 1 is your optic canal, and the optic canal, remember, is for your cranial nerve number 2, which is the optic nerve, and the optic canal transmits the optic nerve ophthalmic artery and the sympathetic branches that are going to supply the eye. We have already discussed about the optic canal. You can always go back. And next is gonna be the superior orbital fissure. This is superior orbital fissure. The superior orbital fissure can be seen here in the sphenoid bone between the greater and the lesser wing of the sphenoid bone. And the superior orbital fissure transmits 4 nerves, and that's cranial nerve number 3, cranial nerve number 4, 6, and the first branch of V5 of trigeminal. Cranial nerve number 3, 4, 6, and V1. These are passing through the superior orbital fissure together with the vein, which is the superior ophthalmic vein. Remember, we've seen the arteries going through the optic canal, and then the superior ophthalmic vein is going through your superior orbital fissure. Next is going to be your foramen rotundum, and the tandem is rounded, and the foramen rotundum is famous for the passage of your maxillary nerve, which is V2. But also it transmits artery of the foramen rotundum and some emissary veins as well. We have already discussed about it. Next is going to be your foramen ovale, which is oval shaped, and the foramen ovale is very famous for transmitting mandibular branch of trigeminal nerve, which is V3, but it also transmits another nerve, which is the lesser petrosal nerve. And then apart from that, it also transmits accessory meningeal artery and the mesocerebral vein. That's for foramen ovale. We are just repeating, and this is also the view on the inferior view viewing your foramen ovale. Next is gonna be your foramen spinosum, and it's like spine of the it resembles like spine of the sphenoid bone, and the foramen spinosum is very important for your famous middle meningeal artery, and the middle meningeal artery and the meningeal branch. Okay, middle meningeal artery, middle meningeal vein, and meningeal branch of mandibular branch of trigeminal nerve, which is also called the nervus spinosus. We have already discussed about it. And next is gonna be your foramen lacerum. Now, foramen lacerum means lacerated foramen, and this is actually confusing. And now I want to emphasize it here a little bit. This is foramen spinosum, lacerum, and it's called the foramen lacerum because it's irregular. And irregular means like it was lacerated. It was lacerated. Now, the foramen is lacerum, we said it's usually covered by a cartilage, a fibrocartilage, and so it is considered the host foramen. It's not really a foramen because of this cartilage which is covered in the foramen lacerum. But we see in your books, a lot of books will write that it transmits the internal carotid artery, the greater petrosal and the deep petrosal. This is the internal carotid artery, this is the deep petrosal, and this is the greater petrosal. And a lot of books will write that it transmits. Yes, it is, but these structures, I've said in the previous discussion, they do not pass through the foramen lacerum, but they are passing above the foramen lacerum. You see, this is the foramen lacerum. If we have the structure that are passing through, like going through the foramen lacerum, they have to go through here and here. Okay, but these structures, they are just passing on the upper part of this foramen lacerum. They are not going through the foramen lacerum. And you can see this is your internal carotid artery, and this is your greater petrosal nerve, and this is your deep petrosal nerve. Now, the internal carotid artery is, it has got its own foramen or canal through which it goes to the foramen, to the cranial cavity, but it passes above on the superior part of the foramen lacerum to enter the cranial cavity. After getting out of the bone canal. We're going to discuss about the internal carotid, the carotid canal now shortly, and this is what I want to emphasize more of the on the foramen lacerum. But sometimes it transmits this is inconsistent. It transmits the branches of ascending pharyngeal artery. The inferior view of the foramen lacerum. This is the inferior view, and remember, these structures are passing above the foramen lacerum. They're not going through the foramen lacerum. Next, going to be your carotid canal. Remember, what's the difference between canal and the foramen? The canal is traveling through the bone, and the foramen is just getting in and getting out. Now, because it's a canal, it should have an opening inside and an opening outside, because it's traveling through bone, and it has got two openings: the opening outside, the opening inside. And this is the outer opening of the carotid canal, and this is the carotid canal, and this is the inner opening of the carotid canal. Now, the internal carotid artery is passing through this outer opening, gets into the carotid canal, traveling within the bone. This is the bone canal, the carotid canal, and then it emerges inside here through the internal opening of the carotid canal, and then it passes above this foramen. What's the name of this foramen again? This is the foramen lacerum. It passes above, but where does it go through? It goes through the internal, through the carotid canal, and once it emerges in the cranial fossa, in the middle cranial fossa, it passes above the foramen lacerum and going to the cavernous sinus system. We haven't discussed about the cavernous sinus, but we'll discuss at some point. So your carotid canal is for your internal carotid artery and the internal carotid artery plexus. This is the plexus of nerves. Remember, we said we do not have the sympathetic nervous system within the head. All the sympathetic have to come through the they have to come from the neck through the superior cervical ganglion. Now we say they are being carried to the brain, to the to the head by the way of the blood vessels, and these blood vessels we name them the carotid vessels. We have the external carotid and the internal carotid. Now the internal carotid will travel through the carotid canal together with the internal carotid plexus, the plexus of nerves which are sympathetic, are going to supply different structures within the within the head. That's your carotid canal. Next gonna be, now we're moving to the posterior cranial fossa. These are the structures within the middle cranial fossa. Now to the posterior cranial fossa, we'll have a foramen here which is called the internal acoustic meatus or the internal auditory meatus. The internal auditory meatus transmits two important nerves. Number one is the facial nerve, which is cranial number 7, and the cranial nerve number 8, which is called the vestibulocochlear nerve. Cranial number 7, number 8, they're going through the internal acoustic meatus. But guess what? Because of the internal acoustic meatus, we also have external acoustic meatus of the temporal bone, right? Now the cranial nerve number 7 is getting into the internal acoustic meatus to leave the cranial cavity, but does not get out of through the external acoustic meatus. Instead, once it gets in the internal acoustic meatus, it travels through a bony tunnel which is called the fascial canal, and then it finds its way somewhere here to emerge the foramen between the styloid process and the mastoid process, and this foramen is called the stylomastoid foramen, the stylomastoid foramen. One more time. Cranial number 7 is called fascial nerve. Get in through the internal, leave the cranial cavity through the internal acoustic meatus or the internal auditory meatus, and then does not get out of the through the external acoustic meatus or external auditory meatus. Instead, it goes through the bone tunnel, which is called the fascial canal, and then finds its way through a foramen here, and this foramen is between the styloid process and the mastoid process, and that foramen is called the stylomastoid foramen. That's your fascial nerve, cranial number 7. And then cranial nerve number 8, now it's got the vestibulocochlear nerve. It's getting in through the internal acoustic meatus, and then it goes to the ear. So it goes to the to supply the ear. That is easy, going through, and it remains in the ear. And then next, in the internal acoustic meatus also passes another artery, an artery which is called labyrinthine artery. This artery is called labyrinthine artery. Now, labyrinthine artery, the word labyrinth is meant for the inner ear. The inner ear is also called the labyrinth. Now, the inner ear derives its blood supply through the labyrinthine artery from the posterior circulation of the brain. It derives its blood supply from the brain from posterior circulation of the brain through the labyrinthine artery, and the labyrinthine artery goes through the internal acoustic meatus together with your fascial nerve and the cranial nerve number 8, which is the vestibulocochlear nerve. Right? So this is the internal acoustic meatus. Next gonna be your jugular foramen here, and the jugular foramen is for cranial nerve number 9, 10, and 11. The internal acoustic meatus is for cranial nerve number 7 and 8. The next three nerves, cranial nerve number 9, 10, and 11, they are passing through the internal jugular foramen. This is the internal jugular foramen. You can see it's a little bit bigger, right? But because they transmit these nerves, 9, 10, and 11, which is your glossopharyngeal, vagus, and spinal accessory, but it's called also jugular. It's called the jugular. So it transmits also jugular vein. What jugular vein? The internal jugular vein. Now these are the content of the jugular foramen: the internal jugular vein and the cranial nerve number 9, 10, and 11. 9, 10, and 11. Next is gonna be your hypoglossal canal, but because it's a canal, it's not a foramen. It has got two openings: the opening inside and the opening outside. The opening outside here is also called the anterior condylar foramen. Why? Because we have occipital condyle, and then we have a foramen anterior to this condyle is called anterior occipital condyle. Anterior condylar foramen, and then we also have a foramen posterior here, which is called the posterior condylar foramen. This is the anterior condylar foramen. Is also called the foramen of hypoglossal canal, because the outer opening of the hypoglossal canal, and then also have inner opening of the hypoglossal canal, because it's a canal, it's a traveling through bone. Remember, you can always remember it's traveling through the bones. Now the hypoglossal canal, it transmits, number 1 is cranial nerve number 12, which is called the hypoglossal nerve. So hypoglossal canal for your hypoglossal nerve, but what the other structures that are passing through, we have the meningeal branches of the ascending pharyngeal artery and the and the medullary veins. Last is gonna be your foramen magnum, and the word magnum means large. So this foramen is large, as you can see, maybe the largest foramen in the cranial cavity. This one, foramen magnum. Now the foramen magnum, it transmits the brain tissue, which is medulla oblongata. Remember, the medulla oblongata is in continuation with the spinal cord. Now, if you are coming from the cranial cavity, once you hit the lower margin of the foramen magnum, we change the name from medulla oblongata to spinal cord because they are in continuation with one another. But if you are coming from the spinal cord, all the way up, once you hit the lower margin of the foramen magnum, we change name from the spinal cord into the medulla oblongata because these two things are in continuation. They are in continuation with one another. What are the other structures that are passing through the foramen magnum? That's going to be your spinal accessory, the spinal root of the cranial nerve number 11. Remember, when we're discussing the anatomy of the cranial nerves, brief anatomy of the cranial nerve, we said the cranial nerve number 11 is a mixed nerve. It's got the cranial part and the spinal part. Cranial part and the spinal part. Now, the spinal part of the cranial nerve number 11, which is spinal accessory nerve, the spinal part is coming from the spinal cord going to the brain, and that's gonna be transmitted through the foramen magnum. It also transmit the foramen magnum also transmit the vertebral arteries. We have seen when we're discussing anatomy of the neck, we have vertebral arteries that are passing through the transverse foramina of the cervical vertebra, and they are going to the brain. Now they are going to the brain through the foramen magnum, and also have venous plexus. One more time, foramen magnum is going to be for your medulla oblongata. It's going to be for your spinal roots of the spinal accessory nerves. You're going to transmit the arteries. Which arteries? The vertebral arteries. And lastly, you're going to transmit the venous plexus. That sounds like pretty much it. If you enjoyed this discussion, don't forget to share it with your friend, like and share it with your friend. But if you have a question, additional comment, put your thoughts in the comment section. Don't forget to follow Instagram and TikTok, and see you really soon.